Hi, my name is Sabrina Bernardez. I'm a cardiologist from Brazil, and I have been working with heart failure for many years, both in clinical and research. I completed my PhD in cardiology in 2015, and that same year I was invited to join the ICHOM working group for heart failure. That was my first contact with value-based healthcare. In 2017, I had the pleasure of joining the executive committee of the Outcomes Measurement Project from the Brazilian Private Hospitals Association. The following year, I took part in founding the Value Management Office at a top cardiology hospital in Brazil. For the past 3 years, I've been part of the VMO team at Einstein Hospital, where I helped design and drive value-based projects, including the Einstein Value Dossier. Well, it all began in 2011 when we started collecting prompts to evaluate the outcomes of new procedures. The idea really took shape when we were inspired by the early value management office models from United States and Sweden. This led us in 2017 to create our one institutional VMO and to start incorporating ICHOM standard set into the health conditions we monitor. Today we track 24 health conditions with follow-up period of up to 10 years. We use prompts not only to monitor outcomes, but also as a tool to provide structure feedback to physicians. Prompts are more just data. They serve as radar to adjust clinical care and even optimize the patient experience. Since 2013, we have shared patient outcomes on Einstein Institutional website, and in 2023, we published our first value dossier. This was not just a report, it drives care improvements. Twice a year, our health economic team, together with quality and safety area and medical leadership, discuss the performance measures results and define together the improvement plans. We also adapt the material for patients in collaboration with Einstein Patient Experience Team and Einstein Patient Advisory Council. For us, measuring outcome is not the end goal, it is a means to transform care, empower patients, and ensure a sustainable healthcare system for the future. The Brazilian Association of Private Hospital, ANEP, represents the country's top private hospital and plays an important role in Brazil's health system. It works on key topics that are essential for keeping healthcare sustainable. In ANEP Health Outcome Program, creates in partnership with ICHOM, is one of the first multi-center projects in Latin America to measure prompts as well as indicator of quality of care and patient experience. The program is designed to foster continual improvement, support population-centered care, and promote peer-to-peer learning through knowledge sharing and on-site visits among the participants' organizations. The program started in 2017 as a pilot with 8 large hospitals in Brazil, beginning with heart failure as the first condition. Today, it includes 26 hospitals and tracks 7 health conditions. By creating a common language around value, enable benchmark across institutions, and act as a catalyst for cultural and clinical transformation, the program has made a significant contribution to the progress of VBHC in Brazil. I have been closely involved since its inception, serving on the program's executive committee and coordinates the heart failure working group. The ANEP program has shown that when hospitals work together, share outcomes, and learn for each other, we can accelerate Brazil's journey toward value-based healthcare. Well, VBHC is gaining traction in Brazil, especially among private hospitals and insurers. We've seen a rise in outcome measurement initiatives, some implementation of IPUs and the pilot projects for value-based payment models. However, financial transformation is still very modest. In Brazil, the main challenges to implementing value-based healthcare include highly fragmented care, poor integration between health information systems, and a culture still driven by volume rather than value. Patient engagement remains low, and social determinants must also be considered in a country like Brazil. Despite these barriers, I have seen strong movements among institutions to deliver better outcomes. Public-private partnerships have been a key driver for this transformation across the Brazilian healthcare system.